Which component of the ECMO circuit is responsible for the actual exchange of oxygen and carbon dioxide? A. Centrifugal pump. B. Heat exchanger. C. Membrane oxygenator. D. Drainage cannula. Answer: C. Membrane oxygenator. Explanation: the membrane oxygenator, often called the artificial lung, uses semi-permeable membranes to allow gas exchange. It is the core component where blood is oxygenated and CO2 is removed. What is the primary purpose of the blender in an ECMO setup? A. To mix venous and arterial blood. B. To mix medical air and pure oxygen to a specific VO2. C. To regulate the temperature of the blood. D. To prevent blood clots by mixing heparin. Answer: B. To mix medical air and pure oxygen to a specific VO2. Explanation: the blender regulates the fraction of inspired oxygen, VO2, delivered to the sweep gas, which then enters the oxygenator. Most modern ECMO circuits utilize which type of pump? A. Roller pump. B. Centrifugal pump. C. Reciprocating pump. D. Diaphragm pump. Answer: B. Centrifugal pump. Explanation: centrifugal pumps are preferred for long-term support because they are non-occlusive, cause less hemolysis, damage to red blood cells, and are afterload dependent. The sweep gas flow rate primarily influences the clearance of which substance? A. Oxygen, O2. B. Nitrogen, N2. C. Carbon dioxide, CO2. D. Lactate. Answer: C. Carbon dioxide, CO2. Explanation: while VO2 controls oxygenation, the rate of gas flow, sweep, across the membrane determines how much CO2 is washed out of the blood. What is the function of the heat exchanger in the ECMO circuit? A. To cool the pump motor. B. To maintain or adjust the patient's body temperature. C. To sterilize the blood. D. To increase the solubility of oxygen. Answer: B. To maintain or adjust the patient's body temperature. Explanation: because blood loses heat quickly while traveling through the external plastic tubing, a heat exchanger, usually integrated into the oxygenator, is required to prevent hypothermia or to manage therapeutic cooling. Which monitoring device is used to measure the oxygen saturation of the blood returning from the patient before it reaches the oxygenator? A. Pulse oximeter. B. Premembrane pressure sensor. C. Venous oxygen saturation, SpO2, monitor. D. Postmembrane blood gas analyzer. Answer: C. Venous oxygen saturation, SpO2, monitor. Explanation: SpO2 monitoring is critical to assess the balance between the patient's oxygen delivery and consumption. Why are ECMO tubings often coated with substances like heparin or phosphorylcholine? A. To make the tubes more flexible. B. To increase the speed of blood flow. C. To improve the biocompatibility and reduce the inflammatory response. D. To prevent the tubes from kinking. Answer: C. To improve the biocompatibility and reduce the inflammatory response. Explanation: these coatings mimic the natural endothelial lining of blood vessels to minimize clot formation and the systemic inflammatory response triggered by blood hitting plastic. In a VA-ECMO setup, the return cannula is typically placed in A. The internal jugular vein. B. The femoral vein. C. The femoral artery. D. The right atrium. Answer: C. The femoral artery. Explanation: in veno-arterial (VA) ECMO, the blood is returned to the arterial system, like the femoral artery or aorta, to provide circulatory/heart support. What does a sudden increase in the pressure gradient, delta P, across the oxygenator usually indicate? A. The pump speed is too low. B. The patient is waking up. C. Clot formation, thrombosis, within the oxygenator. D. The cannula has slipped out. Answer: C. Clot formation, thrombosis, within the oxygenator. Explanation: delta P is the difference between premembrane and postmembrane pressure. A rise suggests increased resistance, usually due to a clot obstructing the membrane. Which piece of equipment is essential for safety to prevent air emboli from reaching the patient? A. A bubble detector. B. A flow probe. C. A pressure transducer. D. A bridge. Answer: A. A bubble detector. Explanation: bubble detectors use ultrasonic sensors to identify air in the circuit. If air is detected, the system typically triggers an alarm and stops the pump to prevent a fatal air embolism.